Good morning. Welcome back to the second day of TUC Disabled Workers Conference. Thank you for joining us for the TUC Disabled Workers Conference panel discussion on the role of visibility in tackling disability discrimination. My name is Anne Galpin, and I am one of the co-chairs of TUC Disabled Workers Committee and an NUJ activist. Today, we have an incredible lineup of speakers to talk to us about the role and importance of visibility in tackling disability discrimination. I will let each panelist give a fuller introduction to who they are later on, but with me on this panel we have Catherine Hale, Director, Chronic Illness Inclusion Project, Deirdre Costigan, National Officer, Disability Equality Unison, Ellen Clifford, National Steering Group Member for Disabled People Against the Cuts, and Julian Allen, Unite Area Health and Safety and Union Learning Rep and Regional and National Equalities Representative and TUC Disabled Workers Committee colleague. Each of our panelists will talk to you between 7 and 10 minutes, telling you a bit about themselves and discuss our theme. We will then have a 10-minute break, and you will have a chance to ask questions. The Q&A function is open. If you have any statements, observations, or points you would like to bring to the panel's attention, please make them using the Q&A function. I will relay questions and points made in the Q&A to the panelists, and I will take the questions in groups of 3. But please let me take 5 minutes to set the scene to which is the backdrop, for this panel discussion. As we heard yesterday, the coronavirus pandemic has shone a stark light on the deep and persistent structural inequalities which cut across our country. The media and the government have downplayed the data, which has revealed that 6 in 10 of all deaths involving COVID-19 were among disabled people. To date, over 100,000 people have died. That means over 60,000 disabled people have lost their lives. We have heard excuses and explanations. We have been told that those who died were older people in care homes. We have been told that those who died had serious underlying health conditions. And we had been told that they had learning disabilities. These in themselves are not reasons to die. They are excuses being made, and they are unacceptable excuses. What they are actually saying it is, to us, these lives matter less than others. We are in an economic downturn, and government data is showing that disabled people are once again the first to be made redundant. Recent Office of National Statistics data has shown that redundancy rates are 62% higher for disabled workers than their non-disabled peers. And again, there is very little acknowledgement or coverage of this in the news. The last 9 to 12 months shows an ongoing downward trend in the number of disabled people in work. Those disabled people already face significant barriers in getting and keeping jobs, as evidenced by the disability employment gap, which stands at almost 30 percentage points. And the disability pay gap is currently 20%, which means that disabled workers earn on average £2.10 less an hour than their non-disabled peers. Yet the government aren't even consulting or introducing mandatory disability pay gap reporting. Recent research found that 2/5 of employers say that they were discouraged from hiring disabled job applicants because of the concerns around supporting them properly during the pandemic, whilst a fifth, 20%, admitted that they would be less likely overall to hire someone with a disability. There were not enough disabled people in work, not enough disabled people at all levels of work, not enough disabled people in politics, not enough disabled people on TV or the radio, and in my own union, not enough behind the screen and in the production room or at the decision-making level either. I mean, in the media, not my own union. Disabled people are not visible in everyday life and are not visible in research or data. but disabled people's visibility at work, in politics, the media, and in research is vital in helping address inequalities. We'll now start hearing discussions. Start the discussion by hearing from Catherine Hale, Deirdre Costigan, Ellen Clifford, and Julian Allen. Catherine, please join us in speaking. Oh, so I meant to say a bit about questions. When we come to the end of the panel, I'll brief you on the questions and we'll have a 10-minute break and then you can be thinking about questions. Thank you.
Thanks, Anne. So yes, today I'm going to be talking about invisible disability. When I was asked to speak today, I thought actually the importance of being visible as a disabled person includes at least 3 different elements. There's identifying as disabled, there's disclosing disability in the workplace, and perhaps most importantly, there's being identified by others as a disabled person. Because unless all 3 of these come together, we actually have no access to disability equality. Without disability disclosure, we can't claim our right to reasonable adjustments. We've got no way of tackling disability discrimination in the workplace. I'm going to explain about how disabled people can be invisible in all 3 of these ways and what the trade union movement can do to tackle it. The issue of who is or isn't a disabled person is deeply political. The parameters of who is classed as disabled have been shaped by successive governments. You only have to think about the way public suspicion of disability faking and cheating has been weaponized against those of us with hidden impairments in order to narrow eligibility for support and cut spending. I was pleased to note there's been increasing awareness of the stigma faced in the workplace by disabled people with hidden impairments. And TUC Wales has done great work in this area, which I highly recommend, their toolkit on hidden impairment. Today, I'm talking specifically about a group of people with a form of hidden impairment, which we call energy limiting chronic illness, or ELCI for short. This is who Chronic Illness Inclusion has just set up to be an advocacy movement for. So this language of ELCI, as I call it for short, and the term energy impairment probably aren't terms you've heard before. They emerged from the work of the Chronic Illness Inclusion Project, which included participatory research among the online communities for people with chronic illness that are found on social media networks, but are not really connected to the disability rights movement. We use the term ELCI to encompass conditions where fatigue or energy limitation is the core and the most restricting feature. And our research shows this is often the case for many autoimmune, respiratory, and neurological conditions, as well as the classic energy limiting conditions you probably would think of, like ME, lupus, fibromyalgia, and now also long COVID is joining us in that area. Many of them are new diagnoses, and some of them are contested by mainstream medicine, like mast cell activation syndrome. Energy impairment can also be an issue with autism and mental distress, and some other physical impairments like cerebral palsy. So what do we mean by this umbrella term? How many people are we talking about? Well, 1 in 3 disabled people in the UK reports impairment of stamina, breathing, or fatigue, and that's a label used by the Office of National Statistics, and it's according to the government's own disability data. And ELCI is a form of hidden impairment, but we're invisible in perhaps a more profound way than other hidden impairments, because ELCI is not just physically invisible, or often physically, not manifest in our bodies, but it's also conceptually invisible, because despite the fact that we're 1 in 3 disabled people, potentially, we're otherwise invisible in the language and framework of impairment and disability that shape social policy, programs and services, and also everyday thinking about disability. There's no commonly used category alongside, say, mobility impairment or sensory impairment. There's nothing that references fatigue or stamina or energy limitation. With chronic illness inclusion, we've ditched the term fatigue and developed the terms ELCI and energy impairment in collaboration with people in our community, because we believe that the word fatigue is part of the problem of why we're invisible as a group of disabled people. And we believe the root of this lies in the medical model of disease. The dominant medical model says disease or impairment only exists if you can measure it and see it, and medicine hasn't yet developed technologies and biomarkers for different fatigue states. So fatigue is associated both within medicine and society generally with a subjective sensation, not an objective loss of function, and it's too readily dismissed as ordinary tiredness. And because of the authority of the medical model within society, we think it explains why our experiences of fatigue and energy limitation are systematically erased within the language of disability and impairment, and explains why we routinely encounter denial, dismissal, and disbelief of our lived experience. Our invisibility as a group of disabled people is bound up with this systemic disbelief of our experiences. And our survey among over 2,000 disabled people with ELCI gives some insights into how this kind of systemic disbelief operates in everyday life and how it denies us recognition as disabled people. So 92% of our respondents said they always or sometimes get told they don't look disabled. 80% agreed that the public's general attitude to chronic illness is that everyone gets tired. What are you making a fuss about? 69% agree that they encounter the view that they shouldn't make a fuss about their difficulties. 83% always or sometimes were met with the attitude that they should try harder to overcome their difficulties. These are the microaggressions of disbelief that pervade everyday life for people with ELCI. We can see what the implications can be for life in the workplace and how they create barriers to disclosure. A quarter of our respondents who met the legal definition of disability said they didn't identify as disabled or they weren't sure if the label applied to them. Around 60% said they feared negative reactions from others if they identified as disabled. And 43% said, I feel like an imposter if I identify as disabled. Our research found that people with ELCI can internalize the disbelief in their own experience of energy impairment. It's a journey that usually starts in the doctor's consulting room in the quest for a diagnosis, and it continues into the benefit system because disbelief in claimants' account of their impairment is almost hardwired into disability assessment systems. All along our journey, our experiences are invalidated or misinterpreted as various kinds of laziness, attention-seeking or malingering, not impairment or disability. And even when we know ourselves to be disabled, we often have a sense that our kind of impairment doesn't count or isn't understood. So 64% said they avoid asking for help or support because they worry about being judged as not genuinely disabled. 65% said the support I need is too difficult to explain or understand. And almost half said the benefits and concessions designed for disabled people don't apply to me. ELCI involves much more than fatigue as it's commonly understood. Its core features usually include cognitive dysfunction and cognitive fatigue, which is in many ways harder to accommodate than kind of muscle fatigue, and sometimes sensory sensitivity, so causing difficulties with lighting and background noise in workplace environments. And the energy impairment is usually inherently fluctuating in nature, which makes it harder to determine what we can and can't do, even in ourselves. This means that barriers in the workplace are subtle and complex, and the adjustments we need are often more individualised than, say, wheelchair accessible venues or communication support. And as a result, when we've asked for adjustments, we're often identified as difficult or high maintenance rather than disabled. And without our disclosures being taken seriously, we have no access to workplace support. So how many jobs are lost and how much talent is lost when workers become chronically ill, but because of systemic disbelief, they don't have that gateway to disability disclosure and reasonable adjustments, things that could have kept them in work? And how can we expect managers, employers, and union reps to understand our experiences when we have no label, no frame of reference for our impairment experience? We're talking, as I said, about 1 in 3 disabled people potentially who are invisible as a cohort. And we think that trade unions should adopt the language we've developed of energy limiting chronic illness and energy impairment in order to give us all visibility as a group and help in the fight for equality at work. Chronic Illness Inclusion would love to work together with trade unions to educate employers, managers, and union reps to understand and take account of ELCI and energy impairment and incorporate it into your work with disabled workers. so that in turn workers can develop the confidence to disclose their disabled status and assert their rights to disability equality at work. And just lastly, to finish off, I just wanted to share that Chronic Illness Inclusion is about to publish a report including recommendations for increasing job opportunities and job retention among disabled people with ELCI. And our launch event is on the 27th of April. If you're interested in attending, please visit our website at Chronic Illness Inclusion and sign up to our mailing list. Thanks very much.
Thank you, Catherine. In a nutshell, you've described some of the battles and barriers that I've faced most of my working career. So I won't be alone, and I hope attendees who experience the same barriers will take heart at Catherine's words, and we will look forward to your report and to our unions working with you. I'll now hand over to the very able Deirdre Costigan from Unison. Thank you.
Thanks very much, and thanks very much for that. As you've said, I'm Deirdre Costigan and I'm from Unison. I'm our National Officer for Disability Equality. And I usually start these things by saying how great it is to be here today. But to be totally honest with you, I'd much prefer if we were back in Bournemouth at the BIC Conference Centre. And then we could all be in the same room and chat to each other over coffee, or even something a bit stronger later on tonight. But as we can't be in Bournemouth, I'm very glad to be here with so many disabled trade unionists from across our movement and with this great panel. And I'm delighted that we're talking about visibility. Many of you will have seen adverts for the census, which takes place on the 24th of March in England, Wales, and Northern Ireland. And there's a line a lot of people use about the census. If you don't get counted, then you don't count. And that's true of disabled people in society and in the workplace. Let's be honest. Before COVID, government really only saw disabled people as people who rely on benefits. And we know the Tories have never been huge fans of people who rely on benefits. And then during COVID, disabled people were either ignored or made to feel like second-class citizens. The word vulnerable was constantly used. And what was missing were the people Unison and all of the other unions in this virtual room represent: disabled workers. Most of the time, it seems that the government just can't imagine that disabled people might work. For example, I'll give you an example. The shielding guidance that came out from government at the start of the pandemic had lots of information about how to keep safe in your house. But it never once mentioned your job. It just assumed that if you were in the extremely clinically vulnerable category, then you couldn't possibly have a job. So Unison raised this with civil servants, and I'm glad to say they actually listened to us. And they eventually changed that guidance. They added in a whole section on what to do about your job if you were shielding and what your rights were. But it just shows where government is coming from. Disabled workers does not compute is the usual answer. And that's where trade unions come in. In Unison, we estimate we have around 200,000 disabled members, 200,000. We say this as often as we can to government, to employers, to other unions. They're probably sick of us. But we say it because it's about visibility. We want people to know that such a huge number of our members are disabled workers, and that those workers are powerful as a collective voice in the union and in society. And we take the same approach to the workplace. We want to make disabled workers visible. One way of doing this is through disability pay gap reporting. We already have it for the gender pay gap. It's not perfect, but it's a start. But there's no disability pay gap reporting at all. And as a result, employers can get away with saying they are disability confident or a good employer without employing a single disabled person or with all of their disabled workers in the lowest paid jobs. Disability pay gap reporting would make this discrimination obvious, and we could actually start to do something about it. So Unison backs the TUC's call for mandatory disability pay gap reporting. But it needs to go beyond simply reporting. Employers should also have to take steps to tackle the pay gap with action plans that are enforced by the Equality and Human Rights Commission. But we will achieve nothing without action on reasonable adjustments. And this is also about visibility. 2/3 of Unison disabled members aren't getting the reasonable adjustments they need at work, because so many employers and government are stuck in a medical model disability time warp. They don't get that disabled people aren't just those with visible impairments. And they think reasonable adjustments are all about ramps and lifts, about bricks and mortar. They don't get that reasonable adjustments can be as simple as starting work a bit later or allowing a worker some disability leave to attend a counselling session. And when an employer refuses to provide adjustments, the worker ends up having to go through the employment tribunal, which wrecks their relationship with their employer and could take years. So many disabled workers do one of three things. They just quietly put up with it, or they end up being hounded out of their job due to their sickness absence, or they leave. And this increases the invisibility of disabled people in the workplace. That's why Unison is calling for a step change in the enforcement of reasonable adjustments, so that there is a much quicker action for disabled workers, so that employers who persistently offend are tackled, and so that disabled people can thrive at work and be promoted and climb that pay ladder. So Unison's 200,000 disabled workers know what our challenge is post-COVID. It's to make disabled workers visible to employers, to government, and to society. And we look forward to working with our comrades across the trade union movement and in DPOs to make this a reality. Thank you.
Thank you very much, Deirdre. The TUC have reported around disability pay gap, and the dates for the last 2 years we've been monitoring it have been the 1st and the 4th of November. I'm a bit foggy on which way round, but we have very good, the TUC has very good stats on that. And generally, as well as Unison's high number of disabled workers, the trade union movement represents about 1 million disabled workers. That's 18% of us. We are one of the largest minorities in the UK. I'd now like to bring in my sister in the struggle, Ellen Clifford from DPAC. Thank you.
Thanks, Annie. So we hear a lot these days about what are often referred to as invisible or hidden disabilities. And I think that that is both a good and a bad thing. I'd say it's good because it reflects all the hard work that's been done by disabled people with non-physical impairments to widen awareness that we can be disabled for reasons that aren't immediately visible. It shows that the message has at least been picked up in some quarters. But there's still so much public ignorance about what disability actually is. It's a subject that I often describe as being shrouded in myths and misperceptions. The international symbol for disability is a wheelchair, and yet only 8% of disabled people need use of a wheelchair. And the size of the disabled population, which Annie just referred to, is so often underestimated. So often people who haven't got their own experience of disability are really quite surprised, I think, when they find out how many of us there actually are. We're the world's largest minority, and in the UK, we're 21% of the population. But a further complexity, as Catherine pointed to, is that not all disabled people do identify as being disabled. The TUC, like the disabled people's movement in Britain, follows a social model of disability, whereby we draw a distinction between the impairments, illnesses, conditions we live with, and disability, which is the experience of oppression that we have on top of our impairments. And the social model is sometimes criticised for many different reasons, but I think it's really important to understand it was never designed to be a perfect theory of disability. I think the key thing to understand is that it's designed primarily as a tool for achieving social change. So there's a vast array of different illnesses, impairments, conditions that we all live with that limit our lives. That can be directly through pain or distress, or reducing our functionality, but also indirectly where people have conditions such as being neurodivergent that society doesn't understand and doesn't accommodate for. Our experiences, therefore, can be very, very, very different between all of us. But what unites us is our shared experience of oppression. And the type of oppression that disabled people face is quite distinct in that it's intrinsically bound up with the socio-economic system that we live under. And so including us isn't just a matter of getting rid of stigma and changing attitudes, but full inclusion of disability means rethinking the way that everything is done and actively providing the support and adjustments that we need to fit into the mainstream. And as Catherine mentioned, in the workplace, what that can mean is employers will often think about putting in a ramp or making physical adjustments, although I think we know that employers are still very bad at doing that. But it can be more challenging for employers to think about the kind of adjustments that are needed for people with fluctuating conditions, whereby the whole way they organise the workplace has to be completely rethought and changed. So we have all these different experiences, but we're united by the shared oppression. And I think the best and most effective way for all of us to challenge the discrimination we face is collectively. And the social model provides an umbrella under which we can unite to make that challenge. So I am a big fan of the social model. And I think I'm very pleased the way that the trade union movement, particularly over the last few years, has really embraced the social model more and now champions it, probably better than a lot of disability organisations do now, actually. And I think that's definitely a very positive way going forwards. Unfortunately, there's still a lot of ignorance within wider society about the social model. And that's another one of the barriers that we have to overcome. But I think we can best do that together. The other challenge, though, that we face is in terms of getting our voices heard. And that's all to do with visibility as well, because disabled people are still at the margins of society and our lives are still largely unseen. Campaigners often understandably can feel that people in society don't care about us, don't care about disabled people. They, after 10 years of austerity and welfare reform and after everything that's done to us, the Tories were then re-elected in 2019. I don't think that it's that people don't care. I think that they just don't know. And I think that the government has done a very good job of hiding what they've been doing to disabled people. We're massively underrepresented in positions of power, as has also been mentioned as well. Out of 650 MPs, I think there's something like only 5 who openly identify as being disabled. And the mainstream media very rarely covers our issues. When it does, it's mainly through news stories that portray us as pity porn victims and speak to non-disabled people from charities about us. Or it's through those hostile programs that portray benefit claimants as scroungers and cheats. So in order to get our issues noticed in a way that doesn't contribute to negative portrayals of disabled people, we have to make ourselves visible. And that's difficult because of all the barriers we face to mobilising, particularly in large numbers. And those barriers are to do with a lack of finances to get to protests, lack of support, lack of choice over your own life in order to be political, communication barriers in terms of disseminating information. But that's why that it's all the more important that we build as big and wide a movement as possible. It's also why Disabled People Against Cuts has always designed our activities aimed directly at making disabled people visible in the places of power where decisions are made about us. So I can't say I've missed it, but we used to have a lot of meetings in Parliament whenever we could, so that people couldn't ignore us. When legal challenges are taken at the High Court, we make sure disabled people are there visible to the judge, and it does make an impact on the judges if they can see that people care about an issue. Under lockdown, of course, all of this has been made much more difficult. And I think that's partly why the government think they've been able to get away with things such as denying people on legacy benefits the £20 uplift. So many people, so many of our brothers and sisters who campaign are shielding, are hidden away, locked behind their doors, fearing for their lives. And so it's made it even more difficult to try and get society to notice what's been happening to us. The fact that 60% of deaths, has been mentioned, are of disabled people. But there have been times when I think we've really shown through lockdown what we can do, despite all the barriers that we face. One small example of that, there are many, it was just recently with the spring budget, and the way that the government steadfastly ignored the call to extend the £20 uplift to legacy benefits. The mainstream media didn't pick it up in any of the coverage they did of the budget. And yet, through pressure from disabled people all across the country on social media, Martin Lewis from the ITV Money Show picked it up. He mentioned it in his prime time interview with the Chancellor, and then again on the Marr Show. So we've really shown the government that they can't hide from these issues, that we will find a way to get to them and expose what they're doing. And of course, we have much more to do, much further to go. All we've achieved really is getting that issue, getting the Chancellor confronted with that issue. But I do think that this is a good example. This campaign is a good example of us all coming together. So charities, trade unions, Unite Community, disabled people's organisations, and the grassroots campaigns. So often we're fragmented and doing separate campaigns, but we've actually joined up on this one. And I think that provides a really strong model going forwards. It's so important, given all the barriers that we face to being visible, that we amplify each other's voices and support each other. So I think that's the way forwards, and I'm hopeful. I think we have to hope that there is a way forwards, that this is going to mean that when we come back from COVID, that we're not going to go back to business as usual, that we're going to be able to come together and fight for a society, one that includes all of us. Thank you.
Solidarity, Ellen, and you can find out more about the DPAC campaign on their website, but here's a little poster to get you. We had a good day of action. Many trade unions are also DPAC activists, obviously, because we double hat in many ways. Now, the importance of collective action on disability equality is at so many levels. But one of the main reasons it's important within the trade union setting is so that the burden of asking for adjustments and fighting discrimination doesn't keep landing so heavily on individual disabled workers. My colleague on the Disabled Workers Committee, Julian Allen, has been fighting this fight for many years now, and I've been proud to work alongside him. He's now going to give us a little insight on what it means to be an equalities rep on the ground. Thank you, Julian, thank you.
Thank you, Chair. Good afternoon, conference. As the disproportionate effect of COVID-19 on Black and disabled workers became clear, a range of individuals and organisations debated why this was the case, with a variety of explanations being put forward, but nowhere was in the debates were the voices of Black and disabled workers heard. Many of us have multiple issues that put us at a greater risk from COVID-19. Myself, as well as being disabled, I'm over 60, I'm from a Black, Asian and ethnic minority background, I'm diabetic, and I'm asthmatic. Due to this, I recently volunteered to join a national vaccine study to look at the effects of COVID-19 and the vaccines on disabled and Black, Asian and ethnic minority communities. Unfortunately, the results of this study won't be known until February 2022. Facing discrimination due to disability and race ultimately leads to worse life chances. TUC analysis has found that the disabled employment gap was larger for disabled, Black, Asian and ethnic minority people. The percentage of the disabled people in employment in 2020 was a low 54.3%, but it was even lower if you were a disabled Black person, dropping to 49.2%. And what about the disability pay gap? The truth is the government data does not allow for proper analysis of this gap. Without this understanding and without taking targeted action to address the ethnicity pay gap and other gaps, such as the disabled workers pay gap, it's made so much more difficult. And the government remains resistant to expanding legislation to go beyond gender. TUC research found almost 1/3, that's 31% of Black women reported being unfairly passed over or denied promotion at work. This rose to nearly half if you were a disabled Black woman, up to 45%. The same research found Black, Asian and ethnic minority women were also denied access to training and development opportunities, and that disabled Black, Asian and ethnic minority women were less likely to have access to opportunities within the workplace. We know disabled people account for 6 in 10 of the COVID-related deaths. We also know that Black men and Black women are 4.2 and 4.3 times respectively more likely than white men and women to die from the coronavirus. We need greater visibility on the data on Black, Asian and ethnic minority and disabled workers so we can properly tailor solutions to the issues that they highlight. At work, I've been trying for nearly a year to obtain information relating to the safeguards for the protected characteristics. We all know the disproportionate effect COVID-19 is having on Black, Asian and ethnic minority communities and the disabled community. But what I wanted to know if this was being reflected within the disabled and the Black, Asian and ethnic minority workforce within Royal Mail. And if so, what additional safeguards were being put in place? We need to have a good conversation on what it means to be Black and disabled, and not wishing to steal catchy phrases, but we need to understand that Black disabled lives matter. As I said yesterday, we will need as many of our activists and our reps to be able to speak for our communities towards the end of this pandemic as we will at the beginning of it. So, as I ended yesterday, I will end today. Keep a wary eye on your own well-being, as our communities will need your support and your voices in the days to come. Solidarity.
Thank you, Julian, very much. We really needed to hear the intersectional angle of the work that you and other colleagues are covering. And you really lead well on our committee on this. We will now have a 10-minute break after our panel speakers for us all to have a short break, and our panel typists also. You will then have a chance to ask questions. The Q&A function is open now, so please do drop them in. And if you have any statements, observations or points you would like to bring to the panel's attention, please make them using this Q&A function. I'll relay the questions and points made in the Q&A to the panelists after our break. We'll come back at, by my clock, which may not be entirely accurate, we'll come back at 12:52. Thank you. Welcome back to our TUC Disabled Workers panel discussion on the role of visibility in tackling disability discrimination. I'm Anne, your chair for today, and with us on the panel we have Catherine Hale, Director, Chronic Illness Inclusion Project, Deirdre Costigan, National Officer, Disability Equality for Unison, Ellen Clifford, National Steering Group Member for Disabled People Against the Cuts, and Julian Allen, Unite Area Health and Safety and Union Learning Rep and Regional and National Equalities Representative, and my colleague on TUC Disabled Workers Committee. lots of chat action out there. Thank you. I'm so glad that this session is resonating with you and connecting with you. Thank you so much for your questions, attendees. And thank you very much for emphasising what I've been feeling the whole way through, that the quality of our speakers this morning has been excellent. Thank you for agreeing, and solidarity to each and every one of our speakers. Now I'm going to take the questions. We're largely grouping the questions, so it may be a sort of, you may find your question melded with others, but it's so that we can get the key issues across that people want to know about. My first question, which will go to all the panel, and you can take turns in answering as you see fit, you know, as it comes to you. How can deaf and disabled people's organisations and the trade union movement effectively work together to assert our rights? What role would a social care service play in this? Over to our speakers. Who'd like to go first?
Shall I?
Ellen, I think. Sorry.
Yeah, I think this question is probably referring to the National Independent Living Support Service proposal that was developed between deaf and disabled people's organisations, campaign groups, and trade unionists. And in short, if anyone's not familiar with that, it's similar to the idea of a national care service, but it has been developed entirely by people who use social care services themselves, and it takes the idea slightly further and is in line with the social model of disability and the idea that deaf and disabled people should have choice and control over the support services that we use. So it wouldn't just be our vision, NILS, as I think it's known, we call it for short, wouldn't just be social care support, but it would be all forms of support that we need in order to live day to day and to have the same chances in life as other people. So it would actually bring access to work within the service. It would be, the idea is that it would, independent living support would be funded from taxation, and it would be free at the point of delivery, and it would be delivered by deaf and disabled people's user-led organisations. So instead of someone working for the DWP doing the access to work assessment, that would be part of an overall independent living support assessment. It's been a really good example, another one of those good examples, I think, so far, of our deaf and disabled people's organisations and trade unionists coming together. It was something that dear Sean McGovern was very much close to his heart. And for him, it was, you know, it's a very arbitrary distinction that you have support at work for one thing, support at home, and they're two different services. He pushed this very much, and we were quite successful in that the TUC Disabled Workers Conference passed it as a motion a couple of years back, and it then went to Congress where it was passed there. It was also passed at Labour Party conference in, what would that have been, 2019, I think, and that was through collective work between trade unionists and disabled campaigners that we got that far. There's still quite a job of work to do with it, in that the Labour Party is still not meeting with us to discuss it, even though it was passed at the policy conference. I think that we need to make alliances with non-disabled trade unionists, particularly those who work in the social care sector as well, and that might be something maybe we could look at with Unison, who I think represents those workers. I think we need to bring more and more people behind this, and this is something that we should be working quite strongly together on, because it's so important. Disabled people are never going to have proper equality until we sort out, you know, the support that we need to live. The Reclaiming Our Futures Alliance, for anyone who doesn't know, is a network across England that brings together deaf and disabled people's organisations and trade unions. So that's been the main vehicle that's been leading on this campaign. And so if anyone wants to find out any more, I should find out the contact details for Ofra and maybe pass them on so that they can be passed on to any participants who are interested in that. Because yeah, it needs more of us. We need more capacity.
Thank you, Ellen. There is a fringe tonight actually on, it's run by Unite, and it's on independent living within the social care, independent living within social care. And that's at 7 o'clock, was it 7:30 tonight? And I'll ask Quinn, could you please pop the details, the link in up for people, because I may have got the time wrong, as you know, I'm time blind. Anyway, Deirdre represents a huge, and Unison represent a huge number of social care workers. So I would like to bring her in now.
Thanks, Anne, and yeah, great to get that introduction to the idea from Ellen, because I think, you know, for a lot of people, the idea of a National Independent Living Service is sort of a new thing that they haven't really thought about before, because we've been so stuck, as I was saying earlier, in this model of disabled people being dependent, you know, and being given social care, and that is how society has been organised. So it's really about flipping that over and talking about independent living, and that needs to be, you know, as part of the social model and educating people on this. We need to use that terminology all the time. And just as an aside, mention personal independence payments. You know, we found a similar thing there. We did a survey of our members, and loads of them said to us that assessors and decision makers were saying to them, you can't have PIP because you're working. They thought that you would only get PIP if you weren't working, you know, and if you were dependent and you needed it. So it is about really changing our perspective on all of these things, including social care. But as you said, Anne, we represent a lot of social care workers. They're a big part of our union. And, you know, an important thing to remember is many of those social care workers are actually disabled themselves. Actually, it's a really low paid job. So surprise, surprise, there's loads of disabled people doing it, you know. So, you know, it's very important for us that it's working together with those workers and the people who are currently in receipt of social care, and how we might build a system that would work for all of those people. And I think when it comes to you know, looking at how a new system would work, you know, it's really important that workers are paid properly and have decent terms and conditions, because that is one of the huge problems at the moment. People who are working in social care have really low rates of pay. They have, you know, no training. The training, you know, they really don't have good levels of training. Health and safety is not great, as we've seen during coronavirus. It's really not great at all, and they're not valued by society. And when that happens, you cannot have quality care. There's just no way you can have quality care. So, you know, disabled people are not getting the care that they deserve, and they're not being helped to do what we really ought to be doing: live independently. It shouldn't be like this kind of, you know, giving care model. It should be a promoting independence model. So I was really delighted to be at a meeting the other night of trade unionists who are looking at how this might work, and we're definitely interested in, you know, going through this, looking at how it might work. But as I say, you know, we need to remember that there are disabled workers who are care workers, and we have to think of everybody in this kind of whole economy of social care and make sure it works for everyone. But independence is totally key.
I couldn't agree more, Deirdre. Sian Stockham, who's our my Unison sister on the Disabled Workers Committee, is both disabled and a social care worker, and she can talk really articulately about the realities of this. And I'd like to actually bring in Catherine now briefly, because actually invisible impairments are one of the more difficult areas for us to receive, for us to even establish a right and a need to access to social care. So Catherine, please, if you want to. Sorry.
That is very true. There's a huge sort of barriers to even accessing social care that again are around this kind of systemic disbelief and invisibility that I spoke about before. I'm really excited by what both Ellen and Deirdre have said about the idea of social care workers and disabled people's organisations coming together behind this vision of independent living and giving more visibility, kind of joining forces so that disabled people are more visible and we have a voice, and all our various kind of factions just join together. I really, really support that vision. I suppose when I saw this question, what I first thought about was the fact that in my history as a disability activist, I've noticed a kind of a bit of a division between disabled people who are not in work, who are mainly activists around welfare system and all the problems that that we all know around that, and disabled people who are in work whose campaign focus is more kind of around their access to work and rights within the workplace, obviously. And my big hope and vision is that we could all join together and support and sort of kind of show solidarity across that. The government divides us into the deserving and the undeserving, disabled people in work or not are the good guys, and those of us not in work are the scroungers. And I would love for that division to be broken and for disabled people in work to get behind this campaign for the £20 uplift for those on legacy benefits that Ellen mentioned in her talk, or I can't remember who it was, but somebody mentioned that campaign, and the campaign to stop and scrap universal credit. That's been a brilliant example of trade unions getting behind a movement that was started by disabled people against cuts, and equally for disabled people out of work to show solidarity to and promote the ideas of reasonable adjustments and disability equality in work. So I don't know if that's slightly off the mark, but that's how I thought of it.
Thank you, Catherine. Once again, a quick visual, a flip for those of you who can see. This is the Disabled People Against the Cut flyer for the No Cuts to Benefits, Keep the £20 Uplift and Fight for More. There's so much we could say. There will be more, as I mentioned earlier, there will be more debate around this very topic in the Unite Fringe held tonight at 7 o'clock, Independent Living with Social Care. Please do join us if you can. There's a sign-up link on the conference website. And the meeting that Deirdre was referencing was the inaugural, or the first, sorry, let's not get posh, the first formal meeting of the Reclaim Our Future Alliance New Independent Living Service Trade Union subgroup, which is co-chaired by Dave Allen, our General Council member and my co-chair here on the committee, and serviced by Rachel O'Brien, who will be for RUEFA, but she will be speaking to us as one of our keynote speakers this afternoon. So you will be hearing more on this if you wish to this afternoon and this evening. And trade unions are welcome to come involved, and we will circulate to your unions the date of our next meeting, which I think is going to be in about 6 weeks' time. I have a question specifically, I think, for Julian, because it's a committee question. It's we would value the committee view if they believe that 10% of workforce jobs should be registered for disabled people. So I think we're talking about quotas here, and we'll start with Julian, and I can help if you like, but I think quotas are dangerous, but I think we need more visibility, so I'm not sure we go about it. But I'd like to hear actually from a more practical, Julian works for the Royal Mail, which is a huge workforce, so he might have a different view and a more practical view. Thank you.
Yes, thank you. And for my part, I've never really wanted anything extra. I want the same considerations, and I always say I expect the same considerations from my communities as are given to every other community. So I've never really been a great one for quotas. In fact, quotas in the past have been very dangerous, especially relating to Black, Asian and ethnic minority communities. I've really worked hard against quotas, and we don't want to go back to the days where disabled people had to carry a card to say they were disabled, and I do struggle with that. But what I would like, and what I would really support, is that there are assessments made of workplaces, and that we identify those jobs that can be done by everybody, and that we don't limit anybody just by a quota, because I can assure you those quotas will give us the worst of those jobs. They won't give us the best, they'll give us the worst. And for my own organisation, we have looked at graduate positions which are being made open for the protected characteristics, but not on a quota basis, on the basis that they will be coming in equally with with the other communities. So I'm hesitant to support a 10%. Why 10%? Why shouldn't it be 50%? You know, I'm hesitant to put a number on anything, but quotas I find a little bit, on a personal basis, I find difficult. I would always go with what my communities ask of me and what my membership asks of me, but on a personal basis, I would be guarded.
Thank you, Julian. You've touched on a very important point about that likely being a race to the bottom in terms of the quality of work we are given. I'd like to bring in Ellen next, because the next question will combine with this question. Ellen and I have had many debate and discussion in public, and, you know, as sisters talking about how we can resolve issues, so save the whale and the planet and make all our lives perfect. Around the issue of our whole government support system around mental distress is geared to work as the desired outcome. Now, work for me is a very positive outcome, but it is not appropriate for all people in mental distress and all people living with impairments at every stage of our working age lives. And so the next question that sort of combines with that would be, the question is, how can we force employers to support mental distress as an impairment and recognise that a worker with living in mental distress is disabled, when it has been underplayed, where it has been underplayed as not a disability? I've got actually direct experience of that. When I first started being active within NUJ, my very helpful rep supporting me, my rep, actually found that they would use hyphenations around Anne's difficulties, referring to the fact that I was experienced workplace bullying and a workplace bullying related breakdown. So Ellen can talk about this from a global perspective, wider perspective. Thank you.
Thanks, Anne. Well, I do have personal experience of it as well. I do remember one job comes to mind where they didn't have a background of employing people who used services. It was a service user involvement role for an organisation that worked with people with mental distress, among other groups, and HR insisted on a report from my psychiatrist. And their attitude was they didn't think it would be possible to employ me with my diagnosis. But I'm pleased to say that in that case kind of proved them wrong and changed some attitudes. But it is so difficult because often we're going as individuals into workplaces where we are alone with diagnoses and support needs, that there's a lot of stigma and misunderstanding around. And I wish there was an easy answer to how we could change employers. It still does depend very much on who the employer is. I have mainly worked within the disability sector, and that makes it easier in that it's hypocritical for those organisations to not be more inclusive, but for people in other sectors it is much more difficult. And I think that what's interesting is it's often assumed that now in this more technological age that there is more inclusion, or there ought to be more inclusion of disabled workers, but actually research has shown that it's more difficult for disabled people to be in work now. There was more chance of being in work when we were when the economy was dominated by industry as opposed to the customer service sector now. and that's due to the kind of barriers that disabled people, particularly with non-visible impairments, face. It throws up a lot of challenges, I think, that directly conflict with the ways that workers are supervised and performance managed. So traditionally that's through things like being on time, or your attendance, and often if you have mental distress you will need periods off work. It's difficult to plan ahead because it's unpredictable. There are things that you face barriers to that other people might not have thought about because they just don't understand what living with mental distress is like. People have a lot of stigma, this idea that you can snap out of it. Unfortunately, for all the anti-stigma campaigns that are out there, that's essentially the way that a lot of people see it. One positive from the pandemic, I think, has been that workers as well as disabled students have made access gains in some ways, through everyone having to work in ways that are easier for some of us. So remote working and home working for lots of us is a lot easier. And so when I was talking earlier about sort of building back better, I mean, I know that Catherine and I have discussed this, that we very much hope that not that everything will continue to be online, because that doesn't suit everyone's access needs, but there will be hybrids in the future that give us the chance to participate as in the same way as other people who can be there. In terms of forcing employers, it's unfortunately it is so much down to the individual to know their rights, to be able to take cases under that. And often if you're living with mental distress, then that's not sometimes something that you can go through. And that's where I think collective organisation through trade unions and through politicisation of disabled people, that's where we have to be pushing and to support each other. I think Julia mentioned something earlier in this particular time about supporting each other, and I think that's one of the biggest things that we get out of organising collectively.
Deirdre, obviously this is an area that Unison has direct experience working around and supporting members. Would you like to contribute? Or
yeah, just briefly on that, Anne, I totally agree with everything that Ellen said. And I think Unison, and I think all of the other unions that are here today, this is our bread and butter, really. You know, I mean, the answer, I guess, to the question is talk to your union, please talk to your union. Because, we do come across this every day, but it's a negotiating job for your rep to do, to go into management and just tell them this is not on, this is absolutely not on. But what we do to try and improve things, and all of the unions do this, we negotiate things like reasonable adjustment passports with employers, and we make sure that that includes an understanding of the social model of disability, and includes an understanding that mental health problems are included in this. And all of the unions here have different versions of those passports, and there is a TUC passport as well. So we get that agreed locally, and that's kind of the answer to it. But I just wanted to come back as well on what Ellen mentioned about different ways of working and how perhaps home working would help some people. And Unison did do a survey back in June of people working during COVID, and you're absolutely right, Ellen, like about 73% of the 5,000 disabled workers who responded to our survey said that they were as productive or more productive because they were working from home. And a lot of those people had mental health problems. But what we are worried about, we are calling for a new right to work from home as a reasonable adjustment if that's what the worker wants. But this panel is about visibility, and one thing we are concerned about is that we do not allow that to be an excuse for employers to stop offering accessible workplaces. You have to have the choice to continue to go to work if you want to, and this should definitely not be a reason for employers to go, do you know what, all the disabled people can work from home. And we don't have to make any changes to our workplace. So I think there's this, we have to be nuanced, don't we, in how we approach that. And I think, Ellen, you're absolutely right. It works for some people, and we just need to be careful about that. Thanks, Anne.
Catherine or Julian, would you like to come in, or shall we move on to, because there's many more questions. I don't know what you'd like to, how do you feel? We've only got about 12 minutes left officially on the clock. Right, let's go on to take a new question. So because I know that you could both actually speak on that in depth, but we're only going to be able to skirt the top at the moment. So this is another question that's come in and I haven't yet, right. Very often, disabled people's campaign groups are excluded from working with the government and big disability charities. What can we do to encourage charities and the government to support and help finance and work directly with campaign groups like Disabled People Against the Cuts, DPAC? So obviously there's a gear in there for Ellen, but I think it's relevant to Catherine's campaign as well. So Catherine, why don't you come in next? Because and then over to Ellen or whoever wishes next.
Yeah, obviously I fundamentally agree with the principle that you know, there's this barrier that government very often says that they're talking to disabled people and their representatives, but who they're really talking to are the sort of 4 or 5 big charities who are generally not, you know, who hardly even have any disabled people working within them, let alone being led by disabled people. What do we do? I mean, I noticed there's a lot more policy language, I suppose I'm saying, around about co-production and user involvement and lived experience, and we need to keep, sometimes those terms sound a bit, you know, a bit overused, but I think we need to keep pushing those concepts of co-production and lived experience to keep promoting the fact that disabled people's organisations are the experts, and we can't be left out of the conversation. It's not good enough just to talk to organisations for disabled people, that they need to create mechanisms in consultation, engagement and co-production to involve people with lived experience and disabled people's user-led organisations. I don't know how else we make this happen, other than I think groups like Reclaiming Our Futures Alliance are you know, doing really well in gathering together disabled people's organisations and making that a common force, so that we're, you know, speaking from a position of power and can, I don't mean take on the big charities, but, you know, we can be have equal weight and have an equal voice, or, you know, try and kind of overcome that sort of dominance, if you like, of the big charities. So yeah, I think that's probably all I'll say on that.
Julian.
Yes, thank you. I fully support my sister there, but my response to most of these questions is going to be the same sort of view. I believe the people that are affected by these changes and any initiative that's coming forward should be the people that are spoken to. And so I would really encourage, if you are able to join a trade union and work through their mechanism to make sure that our communities or the community that they are representing are heard. I would go into community groups. I would look at the disabled groups that are championing our causes. Charities are there for a specific reason, and whether you agree with certain charities or not, very often I cannot support an able-bodied person talking for me, the same as I cannot support a white person talking for me. It has to be the community that is speaking for themselves, but we have to start to do it for ourselves, because nobody is going to do it for us. We have to start getting involved, and nobody can get involved as well as disabled people. We can bring London to a standstill, which we have done before with our protests. We really do need to start to get involved with these groups, and we need to start to shape them so that government has to talk to us. Not that we want to talk to government, but they have to talk to us, that we are the informed source for them to come to.
I think that's a very powerful point there, Julian. And it actually comes down to just a short sort of aside for colleagues who may not be so aware of the difference. When we call it, what we mean by a deaf and disabled people's organisation under the social model of a disability is an organisation that is run and led by deaf and disabled people. Now, so that is fundamentally different, and it comes in with a social model understanding of nothing about us without us. And for people wanting to do deep delving work to really understand this, I urge you to read our UK deaf and disabled people organisations and trade unions work around the United Nations Convention of the Rights of Disabled Persons. And because this fundamentally enshrines our rights as disabled people to be in charge of our lives and to direct our lives, our working lives, our home lives, every aspect of our life. We need to be the person who sets the agenda. Now, I've got a question. I've got one question here that I'm not sure that we're quite the right panel for, but I'll read the question out because my colleagues on the committee in the relevant unions will, I'm sure that they would like to get back to you, Colin, if you leave your email address with the TUC or in the chat. It won't be seen by anybody but the panelists. Colin's question is, could we please update him on the outcome of the SEND that special education needs, is that right? Cuts within the ongoing pandemic. Now, this is a huge issue, and actually the largest proportion of disabled people's deaths during the pandemic have been to people with learning difficulties. So, and often people autistic and people with learning difficulties in detention. So we are coming towards the end of our time, and to give this topic, whilst Ellen, Catherine, Deirdre and Gillian and I will all know stuff, I would rather that this come directly from our colleagues at NEU and NES, UWT, and all the unions that represent education workers, and also to go directly, perhaps also a really good campaign that we're allied with is ALFI, the Alliance for Inclusive Education. I might have abbreviated the name. Ellen, can you quickly come in and
unmute? The Alliance for Inclusive Education.
Oh, it is right. That
yeah, ALFI. Yeah,
it is ALFI. ALFI with 2 L's. So if you want to search for it, because otherwise you'll come up with loads of people called Alfred. Anyway. But I would really recommend their work, and also they have a subgroup which pertains to something that Julian was talking about, and they have a special campaign about disabled Black Lives Matter, and that is run entirely by disabled Black people within ALFI, so and campaigners, and Julian, we've got some joint working there to reach out, but which I'll leave you in charge of. But anyway, so I'll just see if we've got any more questions. Okay, I think actually I realise that I've run, because of my time blindness with autism, it is an issue, and ADHD, it is an issue. I am close to running you over time. So could I, rather than take a new question, could I perhaps turn you over to each of our panelists to give a few closing thoughts about their macro view? I mean, my macro view is that, my big picture view is that we need collective organising, and we need to remove the burden of supporting each and every disabled worker from that individual, because when we most need help is sometimes when we're least able to negotiate as individuals with our employers. Our unions are here to help us, and we need to work in tandem. Over first, Julian, how about you? You spoke last, come in first now.
Thank you, Chair. All I would ask of this conference and my colleagues is to be caring, look out for each other. And as I always say this, and I say this to everybody that I touch, please keep an eye on yourself as well over this. We really do need strength and unity within our movements, and that's all our communities. The protected characteristics really need to be strong, and we need to be together. And if that means that we look out for each other through this pandemic and beyond, that's what we need to do. And we really do need to make sure that our voices are heard at every level. But for our voices to be heard at every level, we need to participate at every level. And that means that we need to volunteer at every level, and we need to make sure we are there at every level. So as always, solidarity, brothers and sisters, and let's go there and let's look out for everybody.
Deirdre?
Thanks, Anne. This has been a really useful panel, I think, because it's interesting to have brought together, unions and deaf and disabled people's organisations together in this one room, as it were. I know loads of people will know that the government is consulting, apparently, on a new disability strategy at the moment. I know, I see Anne, the rest of you won't see this, but Anne is shaking her head because there's been lots of issues with it. And one is about listening to disabled people, because what they've done is we rang them as Unison and said, when are you going to talk to Unison about this? We represent 200,000 disabled workers. And they said, oh, we're not really talking to trade unions. We're talking to disabled people's organisations. So then we talked to our friends in disabled people's organisations, and they said the government told them that the same thing. We're not talking to disabled people's organisations. We want to hear from individual disabled people. And they have this survey out at the moment, don't they, which has been a bit of a mess, that they want individual disabled people to answer. So they don't want to hear from collective representatives of disabled people. They only want to hear from individual, and I don't think they're going to listen to individual disabled people either, let's be honest. It's a classic example of divide and conquer, and this is what the government is trying to do with this survey. And I think the great thing today is we won't let them divide and conquer. We won't let them win in that way. We've shown that we're a great example of how we can all work together, both trade unions and deaf and disabled people's organisations and disability charities. We all have our place, and we can work together, I think, to make a huge difference for disabled workers, because it's time. It is really time. Thanks, Anne.
Catherine?
Yeah, no, really great endings there from everyone. I'll just go back to this, this umbrella idea of hidden impairments in the workplace. And I want to really recommend the work that's been done by TUC Wales to bring this together under the framework of the social model of disability. And I think because there's so many, I've been talking about energy impairment, but there's so many similarities across with mental distress, autism, as well as energy limiting chronic illness, in terms of barriers to even identifying as disabled, to disability disclosure, and to employers, taking seriously the fact that we're disabled people. So I would love to be part of continuing that work and adding that dimension of energy impairment into that picture. Yeah.
I wholeheartedly agree, sister. Ellen? Last but not least.
So firstly, just to make people aware of 2 legal challenges which have been initiated. Legal challenges are something we've used so many times over the years, and they can be very limited in what they can achieve, but at the same time, they can obviously force mitigations, make things slightly better for what the government's doing, but they also give us an opportunity to actually get media, which is quite difficult, and to raise awareness of an issue. So one is against the National Disabilities Strategy that Deirdre just mentioned, and that's being taken on the basis that there wasn't sufficient consultation. And the other is against the failure of the government to extend the £20 uplift to universal credit. So DPAC will be and Inclusion London, keeping people aware of those. and updating people. I wanted to say just a quick word about disabled people being involved in developing solutions and proposals. So we talked about the National Independent Living Support Service. There's also a piece of work Catherine and I are heavily involved in, and we've got a meeting actually after this about, which is a commission on social security. So it's a project that I know some trade unions are already involved in, but it's looking at how we build a better social security system. Our initial proposals came out at the end of last year, and there was wide support for those. We'll be producing our draft white paper probably over the summer sometime, and the next stage to that, hopefully people would agree what's in there, but we're going to need to build a strong movement behind that, behind the need for radical change. Ideas such as having a social security system that provides people with a decent income and treats claimants with dignity shouldn't be radical, but compared to what exists there now is. So it is going to take a lot of us to kind of push for those changes, and that's something that I hope we can all work together on. And then the last three, I think I've got 3 words to close on, which is just solidarity, unity and resistance. Thanks.
Thank you, Ellen. Back at you, sister. There's one more really important so-called consultation going out at the moment, which is around the Mental Health Act and the white paper. We did bring an emergency motion, my union, NEJ, brought an emergency motion on this to this conference, mainly because we wanted to raise awareness that there is a consultation period open until the 21st of April. And I know that the disabled people's organisations, particularly those who are led by service users, are very concerned that there was zero consultation by, service user-led by disabled people. There was some minimal consultation of charities, but as we've explained earlier, this is a very different model. And we work within the social model, the TUC works within the social model, and I just urge you to take a look at that motion just for information, if nothing else. And we've now come to the end of our panel discussion. I know that if attendees could, you would all join me in showing your appreciation to the 4 of you taking the time to share your experience, to the 4 of you, Julian, Deirdre, Catherine and Ellen, taking the time to share your experiences and advice with us. Thank you, panel, on behalf of myself, TUC Disabled Workers Committee and the TUC for joining us today. Attendees, this concludes the panel. There are further discussions today that you can tune into using the same link you have to access this discussion. We will resume at 2 o'clock. I thank you for joining us for the panel discussion and hope you will be able to join us later today for the rest of the conference. Thank you. Solidarity.